Welcome back to the Healthy Chicago podcast, where local health professionals and their guests discuss the latest public health issues affecting Chicagoans.
Welcome back to Healthy Chicago podcast. My name is Antonio King. I'm a public health administrator with the Chicago Department of Public Health. I also serve as the LGBTQ Health and Outreach Liaison with the Chicago Department of Public Health and the citywide. Today, on this episode, my guest is the Reverend Jamie Frazier of Lighthouse Foundation, and are expecting a very robust conversation about community and health and working within the community. Good morning, Jamie. Hi, Jamie.
Hi,
morning, afternoon, one of those. Welcome to Chicago Podcast, Healthy Chicago Department of Public Health. Why don't you introduce yourself and tell us who you are and what you do at the Lighthouse Foundation?
I'm really excited to be a part of this conversation. I think that it's very important to talk about the realities of HIV at the intersection of race and sexual orientation. So this is a timely conversation indeed. I serve as the Executive Director of Lighthouse Foundation. We are a Black LGBTQ plus led multiracial social justice organization that advances justice for Black LGBTQ plus people across Chicagoland through empowerment, education, and entertainment. And to give that in a more bite-sized way, we look at some core areas: economic wellness, spiritual wellness, and physical wellness, because we recognize that when Black queer people, like all folks, experience holistic wellness, we're better and our health outcomes are better.
You did an amazing opening. You should do the opening and not me.
I don't know about that. You're the public health professional.
I can't tell. Talk about how long Lighthouse Foundation has been in existence and what brought it about.
Yeah. So Lighthouse Foundation started in July of 2019, and we started in reaction to a series of racist incidents that unfolded in Chicago's neighborhood, Boystown. And we began organizing as a church, Lighthouse Church, and then people wanted to join the racial justice work that we were doing, and they said, we want to be a part of the work, but not the church. And so at that point, we started a separate organization with a separate budget, separate bylaws, and that's how Lighthouse Foundation was born, with a real eye to helping Black LGBTQ plus folks empower ourselves and also educating our accomplices, those allies that could work alongside Black queer folks for our liberation. That too is an important part of who we are as an organization.
So it was born out of protest,
yes,
and continued because there was a need in the community where people wanted to do something, as our former First Lady Michelle Obama would say, to do something, but they didn't necessarily want to be a part of a religious institution at the time. Okay. Right. That religious, I'm going to go back to that for a minute. The religious institution was Lighthouse Church.
Yes.
That you founded and you were pastoring.
Yes.
Are you no longer pastoring?
Correct. So I retired from that position earlier this year.
Retired? You're 12.
After serving our community for 10 years,
okay,
it was a beautiful and a rewarding experience. But I'm at a stage in my career now where I'm really thinking about, what does theology look like in the public square? What does meeting the needs of those who experience compounded marginality outside of the four walls of the church look like? And I'm very grateful and excited that Lighthouse Church UCC has two new fabulous lead pastors. The church is continuing forward under the leadership of Marcus and Luther, and that means that I get to focus singularly on the work of Lighthouse Foundation.
So, but they're still an affiliation with the church because they're supportive of that.
So we meet sometimes. We also look for ways that we're able to coordinate some of our organizational efforts while respecting the uniqueness and the distinction between the two organizations.
Okay. So does it mean the personnel crossover, or is it all very separate?
So we do. We have one person who crosses over between the two staffs, Marcus. And so his role as not only a pastor of Lighthouse Church, but the manager of organizing for Lighthouse Foundation gives some continuity and some conversation between the two while respecting their distinctiveness.
Okay. So we've laid a foundation, no pun intended, about Lighthouse Foundation and your position and the work that you do. So let's talk more about the community, how that foundation, how the work that you're doing in the community is impacting the community. What do you see, before we get into our topic, what do you see as some of the main needs or deficits and disparities in our community that you guys definitely want to address?
So Lighthouse Foundation, in partnership with Project Thrive, which is an initiative that CDPH and IDPH supports.
Shameless plug.
Yes. has worked really hard to develop a community needs assessment.
Okay.
So Lighthouse Foundation surveyed 500 Black LGBTQ plus folks across Cook County to ask, what do you need? And some of the really interesting feedback that we came with that I wanted to share is 75% of HIV negative respondents said they don't have a prescription for PrEP, and 80% said they don't have a prescription for PEP. 71% of HIV negative folks said that they have no interest in PrEP. So PrEP is pre-exposure prophylaxis. Mm-hmm. It's basically a round of Truvada that you can take to ensure, hopefully, that you do not contract HIV after you may have been in a situation which may have put you at risk for it. And so seeing this high number of folks who identify as Black and LGBTQ plus and are disparately impacted by HIV who are not taking PrEP and PEP tells us that we've got more work to do.
Absolutely.
To communicate why this is important, how it can be life-saving, and also how it can be risk-reducing.
No, I was just go ahead.
So a lot of the ways that we assess the needs of our community outside of just a needs assessment is every time that we have an event, we ask people who have gone to our events, how did this resonate with you? Mm-hmm. What are some of the unmet needs that you have? So after a Black Queer Beach Day, after a Pride Skate Party, after a Self-Care Recharge where we bring in 120 Black queer people to experience the aid of Black queer healing clinicians, we ask, what are your continued unmet needs? There's no way to do community work without investigating, sitting with, and engaging the community about what we need.
So whenever we give out stats and talk about information in the news and stuff like that, we want to follow it up. And I'm glad you followed it up with you said the stats, right. But what you did was you followed it up with what you all did about doing about those stats.
Yes.
So if you've seen that there's a deficit of information and accessibility for PrEP within the community, you've given events and you're making access to where they can get that.
Yes.
And resources as far as health fairs and stuff like that. So how have you seen an improvement in that?
Yeah. So this year, we're really shifting beyond building trust to now offering these resources directly.
What does that mean?
Around HIV prevention. So for the past 3.5 years, we've been focused on having large-scale events with Black LGBTQ plus folk so that they know Lighthouse Foundation can be counted on to meet the needs of our community. Right. And when we had HIV testing or linkage to care, we often did that with partner organizations like CDPH, like Task Force Prevention and Community Services, Chicago Black Gay Men's Caucus, Project VITA. We now, however, have made a shift starting this month to providing HIV testing, counseling, and linkage to care ourselves.
Oh, so you're doing more direct services?
Yes, we are.
Oh. Okay.
Yes, we are. And the reason for that shift is we've already established the trust with the people who are coming to our events.
Right.
So in 2023, we saw 1,000 event attendees. In 2024, we saw double that amount, 2,000 event attendees. So that created within us the desire to more holistically meet their needs beyond an event or a resource fair, but providing the testing, the linkage, and also some of the social service navigation that can really bring about even better health outcomes.
And I believe those numbers because you didn't look at your paper. So if you came out, it must be true numbers. Let's talk more about HIV/AIDS Awareness Day.
Yes.
What that is and what that means to the community.
Yes. This is a really important opportunity for us to think about how does HIV and AIDS impact the Black community. And one of the things that I want to uplift is from the CDC in 2022, they shared with us nationally that Black MSM are 35% of all new HIV cases. And we see that paralleled also on the city level. We see Black MSM, also Black trans women disparately impacted by HIV. Which suggests that, yes, while the overall numbers might be falling, the health disparities continue in terms of comparing Black trans women to Black white trans women or comparing black MSM to white MSM.
But we don't need those numbers. We don't need the numbers from CDC to tell us that.
No.
When you're working in the community, you know this already.
We see it.
We see this every day. We're dealing with this on a regular basis with the quality of life issues that come into account with. And when we run these numbers as far as HIV, new infections, we know who is disproportionately affected. Yeah. So what does that mean for this particular day that it talks about National HIV/AIDS or Black HIV/AIDS Awareness Day?
Yeah. For Lighthouse Foundation, we recognize that the social determinants of health which lead to those disparate impacts, the solutions to those things have to be as interconnected as the problems are.
Exactly.
And so the reason we see a greater prevalence of HIV among black MSM compared to white MSM, we have to think about
men who have sex with men.
Yes, men who have sex with men.
MSM.
We have to think about access to employment. We have to think about smaller sexual networks. We also have to think about access to health care. And so all of these housing,
food.
All
if
of these
I'm hungry,
problems.
I'm not going to worry about whether I'm HIV positive or not. And if I am HIV positive and I'm hungry and homeless, I am not going to worry about being compliant with my meds.
Exactly.
It's hard to think about my being healthy if I'm hungry and I don't know where my next meal is coming from, or if I don't have a roof over my head, especially in a city with inclement weather like Chicago.
And this is what has led to the shift in Lighthouse Foundation's programming, is that if the problems are interlocking, then the solutions have to be interlocking
exactly.
too. And so when we have these events, we're going to have folks on hand that can provide help finding a job, help completing your resume, help securing housing. And sometimes it looks like us providing that directly, and other times with housing, it looks like us being in partnership with other organizations that provide those services like Life is Work.
Are you all positioned to take on the capacity financially to do that?
That's a very good question.
That's why I get paid the big bucks. I'm just kidding.
Well, maybe we need some of those dollars in our grant dollars. So we are currently looking for additional funders to help support and to grow and to expand this work. It is.
That's a heavy lift.
It is. So we have opened up conversations, as you know, with the Chicago Department of Public Health, with the Illinois Department of Public Health, also with Pritzker. We've reached out to some of the people who currently fund us, like Henry Luce Foundation and Wayfair. They're faith and spirituality funders. But because our approach is holistic, we've asked them to support our expanding work, because spiritual wellness, physical wellness, having a job, having housing, all of this is a part of holistic wellness for Black LGBTQ plus people.
What does it mean to the community for us, when I say us, I mean those who do this work, to bring HIV awareness to the community? Where are the deficits? I mean, where are the deficits? I find that what we used to do years ago, when we were trying to reach black individuals, black people, we would go to where they were, like beauty salons, barbershops, the places we hang out. When I'm in the barbershop, and which I'll be tomorrow, the conversation comes up, and I know it's going to come up tomorrow about what's going on in the administration, but also the conversations come up about sex, especially when I walk through the door like, oh, Ken, we got a question for you. We have to do more. We have to accelerate what we're doing in those neighborhoods and in those areas. We have to make those areas our allies. We have to make those our ambassadors. So what is Lighthouse prepared to do, or what are you doing? I know you didn't expect this question. What are you doing to ensure that the message of HIV/AIDS awareness is getting into the community, to the black individuals who are not getting it, especially black women?
Yeah.
Don't give me dead airtime.
I'm about to give you a nuanced response, so I had to gather the words. So Lighthouse Foundation takes an Afrofuturist perspective.
Ooh, okay.
So our question is not what spaces exist, but what spaces need to exist, and then how do we co-create them with community. So for us, it's not, okay, do we go to the laundromat or do we go to X place or Y place? It's, what does our community need? So our community has told us through needs assessments, through feedback, on event forums that they want beach days, that they want opportunities.
Want beach days.
They do. That they want, and let's talk about
day.
why
Who does
they
not
want
want
that.
a beach day?
No, but let's talk about
really?
why Black queer folks want it. Black trans folks have said, we want to be able to be in public space on the South Side where we live, work, and play, and we want to have our full, beautiful Black bodies out on full display. And so Beach Day is not just about an individual enjoying the beach. For our community, it's about us making a statement to the wider community that we're here, we're Black, we're queer, we're beautiful, and we are deserving of public space.
So you're repeating the Beach Day this year?
Absolutely, and we want to do it bigger and better
this
year.
Day, I have to say, last year's Beach Day was phenomenal to me. I'm not a beach person. I'm not a big water person. I love the Midwest. I love snow. I love our lake. That's great.
Yeah.
But I don't go to it often. We used to go as children. When I came there to observe, it was amazing. It was really to look out over the beach from that tower where you all were, where you had the food and the resources, to look out over that and see those all that rainbow on the south side of Chicago. It was phenomenal. It was amazing. And I felt really good, feeling really proud that the health department was helping to sponsor that and make that happen. So I can understand that. I didn't know that it came out of Black gay people saying that they needed to do that, because I'm not one of those people. But I'm going this year, and I'm going to have a little outfit. I might try to get the white together. We keep using something interchangeably, and I think I want the audience and those whoever watching this to understand if there's a distinction.
Yes.
Gay, queer, same gender loving.
So,
because you use queer a lot.
I do.
Yeah.
So
as a 60-something-year-old man, Black man, I don't use queer like that.
Right.
I use it in my spaces professionally, but personally, I don't.
Interestingly enough, I was recently in a 2-day health conference, and the person behind me was reading some Lighthouse Foundation literature, an older Black woman, and she said, "What is a queer?" And so,
what is a queer? That's almost worse. What is the queer? Where the queer?
So it opened up an opportunity for me to turn around and share with her that queer is a term that, for the most part, originated from the academy, and it's kind of an umbrella term which speaks to the fullness of the lesbian, gay, bisexual, transgender, queer community. For some of us, we want the solidarity that comes from all being included in one term. And so for many, myself included, queer is a term that is beautiful because it represents trans folks, it represents gay folks, it represents bi folks, it represents non-binary people. Now, what our research has also shown us in our community needs assessment is that folks' comfortability around the term queer is often predicated on their age. For a lot of older folks, queer is a pejorative term. It was a term that was used in a negative way. I will, though, say some in the academy and in left-leaning community-based organizations are trying to recapture that term, to reclaim it as ours and redefine it. We recognize, though, that the term has trouble, so we use queer and LGBTQ plus interchangeably to acknowledge all of the ways that our community likes to be acknowledged.
And it's important that distinction is that we make that a distinction and understand why.
Yes.
Culturally, in my position, I'm definitely comfortable with it. I'm fine with it. But I understand as I address different populations, depending upon their age and depending on who they are. Most black same-gender loving people don't like the word queer if they're over 45 or 50 years old. Yeah. You happen to be 12, so you like the word.
This gray hair would say otherwise, but I like your testimony.
The fact that you use queer like that says otherwise. I know the truth. But I understand that. I understand that in some circles, my age, 60, 50, 45 and up, they don't like that word because it was weaponized and it was used as a derogatory term. In not just against white people, but Black people too. It was just not a comfortable word. Moving forward as things have evolved, it's funny. My generation is the generation that fought the most so that we could have so much of the rights and privileges that we enjoy. And your generation has recaptured the word and said, we've reclaimed this. This is empowerment for us. And the two have to meet. Yeah. So I think in my position, I'm unique where I go between those two populations, and I'm able to say we're good with this. But I wanted to make sure that as we have viewers who are like, well, they keep saying queer, and then some people are offensive. It's not offensive. Right. It's an umbrella term that we want to encompass as many as we can who want to identify with it. And for those who don't, that's okay too. Yeah. It's okay. If you want to be same, because out of that came same gender loving. Years ago, there were men who did not want to be considered gay or bisexual. I'm same gender loving. Okay. baby, whatever y'all want to be. Yeah. Let's just get it together, but let's do it in solidarity, and let's do it in unity, understanding that one does not make one better than the other.
Yes. And when folks get lost or they don't know what to say, the advice that I often tell folks is allow people to define themselves.
Yes.
And however people want to be called, call them that. It's as simple as that.
And if all else fails, call them by their name.
Yes, this is
call
true.
them by their name. We're good with that. So let's talk more about what do you have coming up that you're going to be doing. I want to go back. Okay. I want to go back to talk more about the intersections that you're working with in Lighthouse. Yes. And by that I mean we've talked a lot about queer Black individuals, and we've talked about trans women of color.
Yes. What
about the others?
Yeah.
What about our lesbian siblings? What about those individuals who don't find themselves labeled? You have to agree with that too.
Yeah. Well, one of the things that I'm excited about in terms of our event programming are our self-care recharges, which
are amazing, by the way. I have to say, the self-care recharging programs you guys have are really amazing. They're out of the box, and they're really good. They're very productive.
And they're done in partnership with the Chicago Department of Public Health.
Well, I think they would be done without us, too.
Well, but we're glad that you're doing it, though.
We are. We're glad to be there.
And we want you to do it again.
Because it's part of innovative sponsorships, and we love doing things that are innovative, and that's what we mean by that. What you've done is, when it came across my desk, self-recharge, I'm like, what is this? You're thinking, okay, y'all going to hire some masseuse, okay, fine. But it's not just that. It's barber. You have barbers there. You have individuals there talking to people with about psychosocial issues they're having, mental health. A lot of that's going on. So in that, how do those individuals who don't find labels find themselves?
Right, yeah. So at our 4 self-care recharges, which we have annually, we typically see about 120 people. Many of them are Black and LGBTQ+. However, many of them are Black, cis, heterosexual women. And so when we say cis as opposed to trans, we mean that a person's identity matches how they would be perceived on the outside. And so the reason I think we've seen so many Black, straight, cis women come to our programming is the same reason they go to Black gay clubs. They want to be able to enjoy the space without being bothered. And so when we have a self-care recharge, we see a lot of lesbian women. We see a lot of Black cis het women. We have our recharges mostly at Gallery Gouchard in Bronzeville. So I think it's a site where a lot of the Gouchards and the art are amazing.
Yeah. And they're amazing people.
They are.
Yeah.
And I think they come into that space because, first of all, it's a beautiful space. Secondly, often women have more openness to self-care. And
what does that mean?
Meaning that when we have a beach day or a pride skate party, we typically see the same amount of men and the same amount of women who come to those events. Okay. However, when we have a self-care day, I think a lot of Black men, even Black gay men, have a lot less comfort around coming into a public space and I'm going to get a massage. A lot of times we don't even feel like we deserve that. And so some of the work that Lighthouse Foundation is doing with Black gay men is just increasing our self-worth, our self-value, our self-esteem. We deserve self-care and to be taken care of as well. But to the women, both lesbian and heterosexual, that come to our programming, particularly our self-care recharges, what I think they enjoy about it is we're giving them seeds of revolution. And what I mean by that is we're offering them patterns and practices that they can leave our space with and live healthier lives, like juicing, like mindfulness practices, like stretching, like mental health practices.
The stretching was hilarious to me.
Well, I think we got your leg up over your head, didn't we?
No, they did not get my leg up over my head, not like that. I stretched out.
Oh, is that what you did? You didn't stretch up.
I did not stretch up.
Okay, all right, okay.
Keep on with your little story. Go ahead.
And so these women who come to our programming and get these seeds are then able to plant those seeds in their workforce. They're able to plant those seeds among friends and family so that other people can be positively impacted by the self-care practices our programming teaches.
But see, women are already, I mean, not to generalize, but we know that, one, men don't take time to take care of themselves. Whether you're heterosexual, gay, same-gender loving, we just don't do it. We're busy. We do not take time to go to the doctors. We don't take time to get massages. If gay men, maybe sometimes, but I don't do a lot of that. I don't do a lot of self-care, stopping, making an appointment, I'll go to the doctor. But as far as I need to get a massage, I need to get my mental health check, we don't do a lot of that. So I think that offering that is something that's needed in our community, because whether we like it or not, there are some things that women do better than men anyway, and taking care of themselves, or a woman loves a good spa day. I mean, really, come on. They love a good spa day. So that gets them. When you say self-care, oh, girl, I got to go to this. Yes, I got to self-care. That's why you're getting so many women. They like that. That's what they do. They'll give mani-pedis. They do that.
I will say one of the unique things about the programming we offer are the clinicians, the people who are providing the services. So
yeah, the barbers are cute.
And we do try. We do try. And I think many of our lesbian community partners have enjoyed the lesbian contractors that we have.
Yes,
because we don't
seek that out often.
Yeah.
The agencies that we work with do not always seek that off. And what's happened is our lesbian sisters have been pushed to the back when it comes to activities, when it comes to events and promotions. They've getting pushed to the back, and you see them being pushed away from even nightlife. We don't have now, except for Nobody's Darling, there really is not another bar or lounge that the women can go to enjoy themselves, to enjoy a drink, and enjoy each other. There used to be 4 or 5 of them. Yeah. We don't have that anymore. They've been pushed out of Boystown. They've been pushed into Andersonville and further on. So we don't have that. So for you to offer that is, again, trailblazing, and again, something that the community needs. What about our youth and young adults? How are we going to make National Black HIV/AIDS Awareness Day open to them, interesting to them? Threw you with that one, I know.
Yeah. So for us, it's a both and strategy. It is both we uplift our partners who work in a dedicated way around that particular demographic.
What does that mean? We uplift our partners.
Task Force Prevention and Community Services. So one of the things I'm always clear about is Lighthouse Foundation cannot do it all.
Okay.
And so we look for our partners who work in specific areas where we may not have particular concentration. So Lighthouse focuses on young people at the ages starting at 18.
Okay.
So we're looking at 18 to 24. That's the phase that we're looking at. So with our workforce development conference, with our self-care recharges, with the ads that we run, that's a demographic that we focus on. However, a task force would be interested in young folks that are younger, 16, 17,
So like
18.
in church, your demographic age is like for church, young adults.
Yes.
And task force has more of a reach and relationship with youth.
Yes.
Okay.
And so ways that we partner, sometimes task force might do an event and Lighthouse Foundation might help to make a financial contribution, or there's a panel discussion and we need to talk about what does it mean to organize Black LGBTQ plus youth, and I call Chris Balthazar, the executive director of task force, and ask him to be on that panel. We're stronger together. And so
Absolutely.
One of the things Lighthouse Foundation strives to do is to convene and to bring our partners together. So at our annual beach day, we have a health pavilion where there are 10 or 11 agencies that come together and they're
like 12,
providing.
actually.
Oh yes,
like
give 12. Us one more.
Yeah, there was like 12.
That provide housing and HIV testing and linkage to care, because no one organization can do it all.
Right.
And what this also means is when our partners have events, we strive to show up for those events as well, so that there's some reciprocity and mutuality in the relationship.
I know you're a preacher, but in these last few moments as we wrap up, give us some final thoughts around the work that needs to be done, not necessarily the work that Lighthouse Foundation is doing, the work that needs to be done, the work that we should be doing around National Black HIV/AIDS Awareness in 30 seconds or less.
To any person that is watching or listening, I would encourage you with this. You are a living lighthouse. You are a place that people will come to for hope, for resources, for rejuvenation, for some inspiration. And in the same way that Lighthouse strives to do that as an organization, you can do that as a person. And we're living in a really dark moment and a tempestuous time, and we need lighthouses all over the world, walking around, offering inspiration and offering support wherever we can.
You are a lighthouse. You need to put that on a T-shirt.
Okay, I'm going to do that.
Y'all need to put that on a T-shirt and sell it.
Will CDPH pay for it?
No.
Oh, okay. All right. I wanted to know
Henry
if there
Louis
was
Gates
generosity.
Get that foundation to pay for it.
All right.
So we thank you again for joining us for another episode, and I hope that you gained something from this. Hope that you gained knowledge. Hope that you gained some strength to do the work that you do. And if you're not doing something, You're a lighthouse. Be a lighthouse. And as our forever First Lady said, do something.
Yes.
There's a work to be done. We thank you for tuning in, and we look forward to seeing you at our next episode.
And that's our show. Thanks for joining us today. Don't forget to rate and subscribe wherever you find podcasts. I'm Dr. Bora, and we'll see you next time.